From that waiting area to right there to the, I always get short when I have to take breaks from the lobby to there to over here, you know, and it's totally different now. It makes me feel good because I know if I didn't have St. Vincent, yeah, I'd probably be dead, you know, just to be honest, you know, just to be honest.
At the outreach clinic at the Central Church here in Galveston, they're doing a really wonderful job of delivering primary care. However, here at St. Vincent's main hub, they're taking a deeper look with the use of point-of-care ultrasound. An innovative example is here at the Heart Failure Clinic, where they've been dramatically reducing readmissions and improving patient outcomes. John Davis is a student doctor here, and he's been instrumental in establishing this program. And there he is. Hey!
Hello.
John Davis, how are you? Bit of a
Pleasure.
bit of a COVID handshake. So this is St. Vincent's main hub. It looks epic. Let's go for a wander around, shall we?
All right, let's do it.
Tell me a little bit about St. Vincent's.
So St. Vincent's House was the social service and healthcare outreach arm for the African American community. We're now seeing kind of an explosion of people from all walks of life that now come here. Anybody who doesn't have anything is more than welcome, especially if they don't have anywhere else to go. So I want to talk a little bit about the technology now, and I brought a little prop with me. So as you can tell, this is not a very big tool, right? This is why this conversation is happening now and not 20 years ago.
When it comes to a deeper physical examination and diagnostics, you've been pioneering something very special when it comes to more acute examinations, right?
That's right. I and several other medical students were given the opportunity to talk about ideas that could be transformational to care in low resource settings. And my argument was that if we were equipped with the proper screening tools here in this setting, we could actually save the healthcare system and, more importantly, the patients a lot of time and effort and money and their health when it comes to preventing hospitalizations. This is a heart, and this is the left side of the heart here, the right side of the heart here. Using ultrasound down here at St. Vincent's, we were effectively able to screen people a lot more frequently, recognize when they're about to get sick, and then ultimately keep them from getting too sick and needing to go back into the hospital.
And why was a cardiology program at St. Vincent's so important? What was creating the demand for that?
60% of people who get hospitalized with heart failure in a year are going to be readmitted within that same year for heart failure again, not to mention for every other complication under the sun. A lot of social determinants of health screening and making sure that we're covering all our bases. We have a food pantry here, we have a lot of other resources, and we want to make sure that we connect you to all of them. So in the last 6 months or so, how many times have you not been able to eat because you couldn't afford to?
So it's not just about actually the use of point-of-care ultrasound, handheld ultrasound to examine the patient, it's about caring for them after that exam, and you call it the 60-day program.
Yeah, that's right. So it's the CHF Comprehensive Care Clinic. Here we try to wrap it around and we provide transportation to and from these clinic appointments, which can be really burdensome and expensive. We offer free medications for anybody who can't afford it. We offer counseling to go over the grief of the experience of being hospitalized and just the pain of suffering with heart failure and having their life's control kind of stripped from them.
With the scarcity of cardiologists in the greater Houston area, for heart failure patients discharged from hospital, they typically have to wait 3 months for outpatient cardiac care. Now for Andrew, whom I'm about to go and meet, who has severe heart failure, that equated to a death sentence. Instead, upon discharge, he enrolled in St. Vincent's Congestive Heart Failure Comprehensive Care Clinic, where 8 months later, he has now surpassed his life expectancy. Hello!
Hello.
Hey, Andrew, when did you start having heart problems?
I'd say about 5 years ago.
Why did they refer you to St. Vincent? I'm assuming you never heard about St. Vincent
No,
before.
because I'm low income. I can't work and I don't have a job.
So who was it that referred you there?
The doctors at the UTMB.
Do you have medical insurance?
No, I'm trying to get some right now. It's a process right now, and I have to be patient for the process because St. Vincent try to help me and my people try to help me on the outside, but it's just a slow process right now.
We're going to take some scans and just look and see how your heart's doing, okay? So I'm just going to have you take your shirts off and we'll be off to the races. What I'm going to do first is I'm just going to place it on your chest and I'm going to point it towards your right shoulder. This is what we
First
call.
time you came here, you must have been petrified because of the condition that you were in.
Yes, because I had lost a lot of weight. I lost a lot of weight, you know what I'm saying? And I think that St. Vincent would help me, you know, because I didn't know what road I was heading down. I didn't know, hey, I might got a month or two to live.
It's going to come in to the left ventricle, but first it's got to go through this valve.
Why is ultrasound, John, so pivotal to what you do here at the cardiology clinic?
Yeah, so specifically here where there's no insurance, if I were to order this as a cardiologist at pretty much any facility, what would ultimately end up happening is that probably bill his insurance, you know, a couple $1,000s to do the image and the read and kind of the whole works. And so if he tried to do this in a traditional healthcare system, he'd never be able to pay for it. And so they just never would schedule it and we wouldn't be able to get the reads out. The importance of the reads is that here I can see how his heart is doing in comparison to every other day that I've seen him, right, for the last year now. I actually have some good news for you, man. I mean, your ejection fraction is up.
Okay, man.
Yeah, you're probably in the 10 to 15% range here.
Okay.
So how does the V-scan extend come in handy?
Yeah, so this V-scan is really nice in that it's got the ejection fraction already built in. So it uses artificial intelligence, give me an estimate. That allows for real-time decision making, right? I'm not qualified as a student doctor to officially interpret these on my own. But if I've got a number and I can just report that the number was this, then other physicians who are licensed are able to weigh in, take my phone call and just say, hey, we acquired an image. It's under a green read and it says that the ejection fraction is 5%. It used to be 20%. Handheld is great in that, you know, when I'm here at the clinic, I got plenty of resources and that's all well and fine, but if I'm seeing Andrew where he is and meeting him where he is, especially if you're having a hard time with transportation, then I'm able just to go over to where he is and acquire these images on the fly. I think that's pretty amazing and ultimately is going to be the future of heart failure care.
See, St. Vincent's told me really my conditions. You know, the hospital only do so much, but at St. Vincent's, they sat me down, did the ultrasound and say, your heart at such and such percent, you need to do this, you need to do that. Hey, and I comply because everything that they told me is helping me out now. I thank St. Vincent for making me like that because at one time I wanted to give up. Everybody need to understand. Life, I know situation in life, but when you got heart congestion failure, kidney failure, it takes a toll on you. Like, man, why am I still here? Why, man, just go and get it over with.